What aging type are you? A Sagger, a sinker, a wrinkler, or a combination? Today, we're going to discuss the different aging types. By understanding which aging type your face falls into, you will better understand how you will age and which treatments will be best for you. We are all going to age eventually and fall into one of these categories, but fortunately, there are many treatments available today, both non-surgical and surgical, so that we don't have to fall too hard into any of these categories and thus can stay our best selves for as long as possible. By the age of 40, you will likely be able to see which aging type you will fall into. And through this video, you will also find out what the best treatment for you will be. You can also predict, if you are younger than 40, which aging type you will fall into based on certain elements. Before I continue with this video, let me briefly introduce myself. I'm Dr. Kim de Tollenade, a cosmetic doctor, and I work at my own clinic, Dr. Contour Clinic in Antwerp, Belgium. You can always take a look at my website drcontour.com for more information. Additionally, a small disclaimer, this video cannot replace a consultation with a doctor, since each case is unique and each treatment must also be personalized to your face. The first aging type that we're going to discuss are the wrinklers. I will briefly cover this type as it is quite self-explanatory and requires somewhat less explanation than the other types. Sean Penn, for example, is a very good example of a wrinkler. With this aging type, we see a prominent presence of wrinkles and lines on the face that are even present when the face is at rest. The lines are often worse around the mouth, the eyes, and forehead as a wrinkler. We often see smoker's lines in this type of patients, even if they do not smoke. These are the lines above the mouth. In Sean Penn's case, it was probably caused by a highly expressive face, but excessive sun exposure, smoking, and dehydration of the skin can also be other causes. If you fall under this aging type, it's important to stay out of the sun as much as possible. Wear summer hats and use SPF cream. Do not smoke and hydrate the skin daily with moisturizing creams. Though these are actually tips that apply to everyone, but especially for this aging type. The use of neuromodulators is obviously a must for this category. Sometimes it may also be necessary to superficially fill the existing lines with filler. Next, we will discuss the Saggers or descenders and the sinkers, the flaters. These are the two most common types and require a bit more explanation.
So, as the face ages, it breaks down into two types of people. Hollowers and saggers. Hollowers lose volume. Saggers are prone to hang and develop bags. You're a hollower.
Does this viewing come with a Valium?
You're hilarious.
Oh, I'm serious.
As the face ages, our skin tissue begins to separate, leading to irregular contours. This results either in a decrease in tissue volume, which creates a more hollow, sunken appearance, hence the term sinkers, or in sagging, which leads to a more drooping or slack appearance, hence the term saggers. But how can you tell which category you will belong to or already belong to if you have reached a certain age? First and foremost, you can look at your parents and how they aged, and this will be an indication of how you will age. Genetics play a significant role here. However, you can still estimate it by looking at the thickness of the skin and the thickness of the underlying soft tissue. That is, how full the face actually is. Now take a look at the sisters Bella and Gigi Hadid. These are two very beautiful ladies, but there is one major difference in their faces. Bella Hadid has a sharply defined face at a relatively young age. The underlying bone structure is also clearly visible. And then we see Gigi Hadid. In the photo, we cannot see the thickness of the skin very well, but we do see that she has a lot of underlying soft tissue, thus a much fuller face than Bella. The sisters are not old enough to show their aging process, but based on their faces, we can somewhat predict who will likely deflate, the sinker, Bella, and who will primarily sag, Gigi. It is often the case that people with a fuller or rounder face are more likely to be saggers because they have a lot of facial fat, which causes the face to sag earlier. But let's now illustrate this with celebrities who have lived a bit bit longer to demonstrate is better. I like to use photos of celebrities because these individuals and photos are public and can be used, and people often recognize them too. It's not that I want to shame celebrities. I mean, we all age and there is no shame in that. Or that I want to turn my video channel into a celebrity channel. That's not at all my niche. But it's just easier to illustrate everything in this way. I also want to mention that since celebrities have the financial resources to access all types of anti-aging treatments, their aging types often appear more subtly. Through effective use of things like injectables, aging is less visibly apparent and sagging in a sagger will be less noticeable, while the hollowed areas in a sinker are better camouflaged. Therefore, celebrities are not the best examples because their aging tends to be subtler than the average person due to so much assistance. So keep that in mind. Now, let's take a look at Drew Barrymore and Angelina Jolie. This is Drew Barrymore in her younger years. You can see she has a thicker skin with a lot of underlying soft tissue. She clearly has a fuller face. And let's compare this to someone like Angelina Jolie. Then we see that the underlying bone tissue in Drew Barrymore is much less visible. Angelina Jolie's face is much more sharply outlined and defined even at a young age. So, based on Drew Barrymore's face at a relatively young age, we can estimate that she will likely belong to the Sagger category. When a person is a Sagger, the skin and underlying soft tissue remain quite thick. But since we all lose collagen, elastin and fat pads due to aging, the skin begins to sag and the volume in the face moves to the lower part of the face. These people will develop a more square-shaped face as they age and often can develop jowls and nasolabial folds. If you remember my previous video about how the face ages, I talked about how the youthful V shape of the face changes to an inverted V. And this is very noticeable in saggers. As time passes, the skin loses its firmness and becomes looser. This is often described as if the skin is slipping away from the underlying structure. Despite the fact that saggers do not lose a tremendous amount of volume and thus sag more, fillers can still be a good idea in the upper part of the face, as they can provide a bit of lifting and support for the lower part of the face and also add extra volume where it has begun to sag. So the treatment mainly consists of adding volume in strategically correct places and stimulating collagen through the use of fillers based on hyaluronic acid and biostimulators such as Radiesse and Sculptra. They are also ideal candidates for thread lifts. A thread lift is a non-surgical treatment where temporary dissolvable sutures are placed under the skin to lift and tighten it. A thread lift is ideal for when a surgical facelift is not really necessary yet, or if you want to delay a surgical facelift. Saggers eventually become ideal candidates for a surgical facelift. Angelina Jolie, on the other hand, is a sinker. As you can see, she had a sharply defined face with more angular and defined features in her younger years. You can clearly see her underlying bone structure. She has very defined cheekbones and a very tight jawline. She also clearly has fewer fat pads in her face compared to Drew Barrymore, for example. But as time passes, you see that face begins to sink more and more. Unlike the saggers, the face doesn't begin to hang. Instead, the volume in the face tends to disappear, which can give the face a sunken, hollow appearance. We probably don't see Angelina Jolie's face entirely naturally, since celebrities often have access to all anti-aging treatment, but nonetheless, we can see that she has lost some volume in the face. Sinkers often lose volume in the area of the temples, the area below the cheekbones and around the eyes. The eye sockets, cheekbones, and even the nose can seem more prominent as we age, since all other facial features have sunken in, making these elements appear larger. As we age, everyone's nose also gets slightly larger as the tip of the nose begins to tilt downward, and this is further emphasized by the loss of volume in the face. Sinkers are the best candidates for fillers because fillers can add extra volume to the face. The use of biostimulators such as Sculptra can also be useful, as they can naturally add volume to the face and at the same time improve the quality of the skin. These people are not ideal candidates for a surgical facelift, since it can often appear unnatural on them. It is important to choose a skilled cosmetic doctor to add extra volume to the face, who can add the right amount of filler without it becoming too much. Look at Sylvester Stallone in his younger years and now. Sylvester Stallone clearly falls into the sinker category if you look at his face in his younger years, and likely as a result he has lost quite a lot of volume in the face, which has led him to overcompensate with cosmetic procedures to restore volume to the face. But We see in Sylvester Stallone that he has received an overfilling, making his face look a bit artificial. This can be avoided by choosing the right doctor. One can opt for the typical hyaluronic acid filler, but fillers based on PLLA, such as Sculptra, can also be an option since they add volume in a very natural way and will reduce wrinkles and folds by stimulating the natural production of collagen in the skin for gradual and long-lasting improvements. Some people fall into a combination of these aging types, where there is both sinking and sagging. A good example of this is Cameron Diaz. Here you have an example from when she was in her 20s, and then a photo from when she was 40. We can see that it begins to sink around the eyes, even around the lower face, and starts to sag a bit. And then here, she is about 50 and we can visually see that it sinks around the eyes. Her nose also looks bigger and more prominent. You can also see that she begins to get heavier in the lower face due to some accumulation of loose skin and fat. With the right anti-aging treatments, you can sometimes not even recognize your aging type in your face anymore. Just look at Jessica Alba, who is already 42 years old but still looks almost the same as when she was 20, without appearing unnatural. This is therefore the result of a successful treatment by the right doctor. In addition, your weight also influences your aging type. Often, people who are athletic and slim tend to be a sinker or deflator, but this is certainly not an absolute rule since we have enough examples of people who are quite athletic and thin, yet still have a fairly full face with a lot of facial fat. Just look at Miranda Kerr or Gigi Hadid. But it is also true that weight changes can affect your aging type. For example, Bridget Fonda, as she aged, developed more sculpted facial features due to a loss of volume in the face. When she stopped acting, she gained a lot of weight, which caused her to evolve from a sinker or deflator into a sagger. If you then lose weight again, you can also evolve from a sagger to a sinker. We see this, for example, with 50 Cent. It is true that generally people who are quite slim and athletic will show signs of aging faster since facial fat can more easily camouflage this. The French actress Catherine Deneuve is also known for her quote, "After a certain age, you have to choose between your face and your fanny." But fortunately, it's thanks to modern options such as injectables and others, we no longer have to choose between the two. If you found this video interesting, please give it a thumbs up and subscribe to my channel. Whether you are a sagger, a sinker or a wrinkler, at my clinic, Dr. Contour Clinic in Antwerp, you can come to me as an aesthetic doctor for treatments to address these signs of aging in a natural way. You can book a consultation and our treatment via the website of my clinic, for which you will find a link in the description of this video. Until next time, bye!